Fast, hot, and fresh. Open 24 hours just for you. Dodge's Store. Come be our guest. Dodge's Store, Ripley. We are 100% employee owned with friendly service and a fun atmosphere. High quality, low prices. We are Food Giant. Our deli serving breakfast, lunch, supper. Food Giant, 702 Highway 15 North, Ripley. Come shop Food Giant. Want fresh meat and fresh produce? Food Giant's the place. High quality, low prices, Food Giant. This program brought to you by Cardinal Drive-In. Cardinal Drive-In, 1807 City Avenue North, Ripley. Cardinal Drive-In, 837-2970.
Little corner. We just came in this what they call Hospital Road in behind the hospital, and we noticed that there's a new doctor in town. He's a Dr. Keith Box, and it's 993-9255. Box Family Medicine Clinic, Advanced and Preventive Care. We'll be calling him and see if he's interested and coming to the little corner to meet the people. This is Daryl Jeter, just keeping up with what's...
Well, I did contact Dr. Box, and sure enough, here he is. Dr. Box, I want to welcome you to Daryl's little corner.
Well, thank you.
And we're going to get to know him. I've been sitting here talking to him, and he's a really nice guy. And from now on, if you see him in the grocery store, just walk up and say, "Oh, I know you. I saw you on TV." He friendly fella. He's not going. He ain't gonna bite you or nothing. Something about a doctor, you just think you can't just go talk to a doctor, but you can. You can. In fact, tell us where you're from.
Well, I grew up here in Ripley. I went to Ripley High School, graduated from Ripley High School in 1996. Shortly after that, I went to Northeast Community College, spent 2 years there. From 96 to 98, and ended up graduating from Mississippi State in 2002. Spent 2 years working at the hospital in New Albany, Mississippi in the surgery department. I was an OR tech at that time. I scrubbed in on various surgeries and assisted all the surgeons there. And then in 2004, I got into medical school, and I went to a medical school in Pikeville, Kentucky, which is pretty much in the middle of nowhere. It's called Pikeville College School of Osteopathic Medicine. And shortly after I finished medical school in 2008, and I came back home to Tupelo, and I did my family medicine training at the Family Medicine Residency Training Program in Tupelo, Mississippi.
Well, you're just a hometown boy.
I am.
Went to these schools at Tippah County and played with these other. Well, I bet everybody knowed him but me. I'm telling you. I bet my kids knowed you. I bet my kids do. Some of you watching probably went to school with him. You look there and say, "Ooh, there's Keith. Look at there." Yes, that's what I do when I see somebody I know on. We see a lot of local people on this channel, and I'll see them, and I say, "Oh, look at there." like I had never seen them before. I'm awful. Well, tell me, why did you decide on Ripley? You've been to Tupelo. You know, you think big town, you make more money. Why did you decide on Ripley?
Well, I decided on Ripley. Number one, it was home for me. I'm used to the area up here. There was a great need for a family practice physician up here, and I felt that the Lord was calling me to come back home to provide health care.
You know, we got some good doctors, but our older doctors, they're getting old, they're retiring, and some of them have died.
Yeah.
You know, I remember when some of them came to town, you know, and had black hair. You know, now they look like me. Speak of that. But, you know, really, you're right. We do need some doctors here, and we need doctors that have time for the people. I know you just opened your clinic, And you got a lot of time now, but always remember that we need doctors that have time for those people. And one thing I like about Dr. Box that I have discovered, this is the second time I've talked to him, but I've discovered he talks to you. I like that. I like a doctor. If you look at me and you said, "Oh, your nose is crooked," I want to know. Don't just write it on that paper. Tell me my nose is crooked. A lot of times doctors assume that we know, but we don't know. We don't know. We go in there and they say, "We're going to test for so and so," and they might say, "Oh well, it's probably not that," but just be sure, and because they're testing, we think we got it. That's a wonderful thing that you talk to the people.
Yes.
And I've noticed that in you. Let's just solve the mystery. Why do your signs say D.O., not M? I notice on your shirt it says D.O.
Well, D.O. stands for Doctor of Osteopathic Medicine. And osteopathic medicine is just a little bit different philosophy than what your MD medical schools teach. Your MDs are called allopathic medical doctors, and your DOs are called osteopathic medical doctors. One of the reasons I chose DO school was I like the philosophy behind it. What makes osteopathic medicine different than allopathic medicine is that the central theme for osteopathic medicine is that we take a whole body approach to treating patients. We don't just treat one area. Like if you come in and say my shoulder hurts, we want to make sure that there's not something else going on that's causing your shoulder to hurt, rather than just looking at your shoulder. We take that whole body approach. And another one of the central themes in the osteopathic philosophy is that your body has its own innate ability to heal itself. And if everything's in proper alignment and is working well, your body will heal itself. And so we get a little bit extra training in musculoskeletal medicine, where we have various techniques that we can use to try to put the body back in proper alignment.
That makes sense to me. Everything on you connects to something else. That makes sense.
If your body's in proper alignment, that means the conduction from your nerves that's going down from your head to your toe, that they're moving better. Your lymphatic drainage is flowing better through your lymph vessels, and your blood's flowing better through your blood vessels. So if you have to take medications for anything, those medications get to that area that it needs to get to better if you're in proper alignment.
Now you know he's a doctor. All them big words. He's a doctor. That's it. You write down anything you want to on that shirt, you're a doctor. We have figured it out. But it does make sense. It does make good sense. And a lot of things that we don't do are just common sense, and we should. We should. Exercise, proper diet. Nobody does it, but you're supposed to. And if we did, we'd be healthier. Do you specialize in anything in particular, or do you just tell us a little about what you do?
Okay, I'm just a family medicine doctor. I see people of all ages. The old adage that family medicine doctors have is we see them from the womb to the tomb. So I see, infants all the way up to nursing home patients.
Babies. Babies. We don't really have a baby doctor in town, and we need that. We need that. And us old folks, we're all healthy. Forget it. No, we're not all healthy, but that's good. That's a good thought, though, isn't it? Well, do you accept most insurances?
We do. We're currently in the process of getting credentialed up for most of the insurances. There's some that we're not currently credentialed for, but the paperwork has been filed, and we're just waiting to hear back from them.
The local factories, Ashley Insurance, Medicare, Medicaid, just Blue Cross, whatever.
Yeah.
Whatever. I wondered too, if someone is a patient, a regular patient, sees you on a regular basis, shows up. I ain't good at showing up. Just shows up and comes regularly, and they run out, they realize that they're missing a refill on one of their medicines. Can they get that called in?
Yes.
Okay.
In fact, we have an electronic health record at our clinic that if a patient calls in and they need a refill on their medication, we can actually put it in the computer and electronically send it to the pharmacy.
Well, now, one thing that I do, I'm guilty of it, Tate's not, but when you hopscotch from doctor to doctor to doctor, you don't have that advantage, do you?
You don't.
Because you really need one medical record. And, yeah.
Yeah, what I call doctor shopping is not something that I would advise people to do.
I don't shop for one. I call whoever will see me. I do. No patience whatsoever. None. If I call, you can't see me. I call somebody else. I'm awful. All right, this is the flu season, isn't it?
It is.
Ugh.
Just the beginning of it.
All right. Well, tell us about these flu shots. They don't take effect for a while, do they?
Well,
is it too late?
It's not too late. In fact, I typically don't recommend getting the flu shot until around the latter part of November anyway.
Really?
Simply because, some people get them in October, and I think that's fine. And the flu shots this year are supposedly supposed to last the entire year, but I know in the past I've seen instances where patients have gotten a flu shot in October, and by February the flu shot's done wore off, and so they end up getting the flu February, March, or whenever around the late stages of the flu season. Like I said, these new flu shots, they're supposed to last an entire year. And so if you got one in October, you're probably going to be covered. But I definitely recommend getting the flu shot. And I typically tell my patients to wait till about November to get it.
Well, never thought of that. How does a doctor, now you're with all these people and they're coughing and hacking and burning up with fever, how do you keep from getting the flu?
Well, that's an interesting question. One thing is I take a flu shot every year, and ever since I've been taking the flu shot, knock on wood, I haven't gotten the flu. But the key I think for us not getting it and for us not spreading it to other patients is basically hand washing. I make sure when I go into a patient's room, I wash my hands before I touch the patient, and I wash my hands after I touch the patient. So good hand hygiene is the key to keeping from spreading, whether it's the flu or whether it's any of these viruses that cause upper respiratory infections, or the GI viruses, or some of these viruses that there's not any immunizations out there for.
Yeah. Well, I tell you, when I was younger, I would give it a thought. But as I've got older, I can't just pass stuff off like I used to. And if a doctor came in the room and did not wash their hands, I don't believe let them touch me. I'm a fanatic on it.
Yeah.
And those gloves that are hanging on the wall at the hospital, they ain't sterile.
No.
They're not clean. That's to protect them. Well, I'm worried about protecting me, and I don't know why they don't. They need a suggestion box, but use sterile gloves.
Yep.
I've seen them come in and do procedures. I know my friend had a cut on the back of her leg. I mean, it was a surgery cut. It was taken out and had to heal from the inside out, and they would come in and clean that out with this little machine. It was like a mini vacuum cleaner, looked like. But anyway, you know what it is, I don't. I'm pitiful. And they would just take them gloves off the wall. And I just pitched a fit, and I went home and I called the director of nursing. And I said, I can't believe that it's not, sterile gloves. Well, she said, I hadn't worked out on the floor in a while, and I don't know what the protocol is. I said, well, I thought it was to be clean. I'm just awful. I'm awful. And I noticed the next time they came in there, they used sterile gloves. Maybe they just hadn't realized that somebody was going in there. But now I'm a fanatic, and if you're at the doctor or the hospital, you just think about it. If he doesn't wash his hands, or he uses them old wanky things on the wall, for my part, they throw them in the garbage. I don't want them used on me, because I don't want somebody else's germ. I've seen people go in and play with them gloves, blow them up like a balloon. Nasty.
I know, at least in my office, if a glove gets pulled out of the glove box on the wall, it gets thrown in the garbage can.
I was impressed.
It doesn't get put back in.
When I was in your office, I was impressed with how clean it is.
Well, thank you.
It is spotless, and I wanted to say that it is clean, and I don't believe you're gonna pick up somebody else's germs there. You know, that's a hard thing. That's the best place in the world to get sick, doctor's office or hospital.
That's exactly right. I tell patients when I have them in the hospital, if they get to feeling better, I tell them that we need to send them home before they get sicker.
That's right, absolutely. And it just truly, it is the cleanest doctor's office I've ever been in.
Well, thank you.
It really is. And, you know, that's a plus to me. That's important. Because like I say, if they come in from the other room and they don't wash their hands, why, you don't know what that patient had, you know. And you're leaving yourself wide open. Now, from now on, everybody listening will be checking that out.
Yeah.
They'll say, Daryl says don't use those gloves. You tell them. I don't care. Okay, any advice about, about like, we used to hear it, old folks, now I'm old now, so I say starve a cold and you'll feed a fever. Is that right?
I think it's actually the reverse of that.
Oh, really?
I think you feed a cold and starve a fever. So sometimes people that have fevers, if they eat a little too much, they'll end up throwing it back up. Particularly kids who are on the bottle at this time, if they're running a fever, sometimes that milk will get into their stomach and it'll clabber up and they'll end up regurgitating that back up. It's actually the other. But I really don't know if there's anything to that idea that you feed a cold that it's going to get rid of, help it any faster. I know I trained with Dr. Ed Hill, who does the 60-second house call down for Channel 9
really?
News.
Did you?
He's the program director down there now, but he was one of our attending physicians, so he had a hand in training me down in Tupelo, and he's a big believer that chicken soup really helps with colds and upper respiratory tract things, and it makes you feel better. And even if you have like a GI bug that's causing you to have vomiting and diarrhea, if you can tolerate anything in your stomach, chicken soup's something pretty good to take. Other than that, just same thing as far as keeping from spreading the flu. Good hand washing and good overall hygiene helps prevent the spread of these various viruses that cause these colds and upper respiratory symptoms and GI symptoms.
You know, our granddaughter had the flu, and I just knew everybody in the family would have it, but they didn't want that stuff. And they put a mask on her, like one of them little things like you protect yourself, and put her in another room. And when they went in that room, they wore a mask, and nobody got the flu. She was the only one who had that. That just amazed me. I remember that. I was really impressed. What would you suggest to help lose these Christmas pounds?
Well, I think it's going to be the same thing I would suggest for any other person that comes to me that wants to discuss weight loss. The key to weight loss that you can sustain is just simple enough having patience. There's a lot of fad diets out there, and there's a lot of supplements that are out there that people try to convince you to take. And the problem with a lot of these fad diets, such as, in my opinion, such as the Atkins diet and the South Beach diet and various other diets, is that you end up losing the weight too quickly. And what happens when you lose weight too quickly is that your body gets to a point where it gets shocked, and your body, similar to what I said, has its own innate ability to heal itself. Your body basically tells your brain, all right, you're not doing this to me again. So suddenly you start gaining that weight back. And then when you get back to where you once were, you end up overshooting that, and you end up gaining more back than what you had to begin with. So it's kind of a vicious cycle that gets started there. And when I say the key is patience, you got to have patience to realize that I'm not going to lose 30 pounds in a month and be able to sustain it. If I lose 5 pounds in a month, that's going to be something that I can sustain over a longer period of time. And in my opinion, the key is basically your dietary habits. And one of the things I do with patients is I do a calorie restriction diet. And I typically start out with a moderate calorie restriction, and I have a formula where I figure up how many calories that a patient should eat. And I put them on that, and I tell them to, watch your calories. The other key is going to be exercise. And I really recommend getting exercise. There is actually a program that the Wellness Center has where you can actually get a medical referral to go out and have an assessment done at the Wellness Center, and you get a few days, but you can go in there for no cost, I believe it is. I'm not 100% certain on that, so don't exactly quote me there, but I think that's the case. But I've given that to several folks to try to help them lose weight. And what happens is the more you exercise, you can actually gain some of those calories that you can eat back. So you can actually maybe eat just a little bit more and lose weight. But the key to losing weight is patience and watching your calorie intake.
Now, does it make a difference, now this exercise thing, like I have an exercise bike. I have a bad knee, which most people my age do. And does it make any difference if I get on that bike and ride it 30 minutes or if I ride it, say, 10 minutes 3 times a day?
I think it's better to get on there and ride it for 30 minutes rather than 10 minutes 3 times a day, because in that 30-minute span, you're going to get your heart rate up and going, and when your heart rate's going, everything's flowing faster in you, and you're actually going to burn more calories that way than you would if you did it 3 separate times, just 10 minutes at a time. Because 10 minutes, it's probably going to take most folks about 10 minutes to really get their heart rate up and going and getting that pre-claw sweat that they need to get when they really know that they're burning calories and expending energy.
Well, while we're on it, this exercise bike, is that good for that knee or am I wearing it out?
Exercise bike is probably one of the better exercises for a knee. Typically, that's going to be better than trying to jog on that knee or walking on a treadmill or whatnot. Another thing that's pretty good for knees is and they have them at the Wellness Center, are the elliptical machines. Those tend to be a little bit easier on the knees than some of the treadmills and just walking around the track does.
Then on this vitamin thing, what would you recommend an average person to take as far as I mean, you go to like the drugstore and buy all these over-the-counter vitamins. Pretty soon you're taking 15 pills a day. What would you recommend?
I would recommend anyone, particularly if you're over 50 years of age, I would recommend just getting you a good daily multivitamin that's got a lot of several different things in it. I think one vitamin that I really recommend to most people these days that I screen for when you come to my clinic for a routine physical exam, and what contributes to the deficiency of this vitamin is basically our habits that we have become accustomed to over time, and that's vitamin D. And the most abundant source of vitamin D, obviously, is sunlight. And I think in today's day and age, people just don't get outside and in the sun as much as they used to. And so I've seen a lot of people that are either insufficient or deficient in their vitamin D levels. And there's studies out there now that show that, low levels of vitamin D are directly linked to various cancers and also heart disease, osteoporosis, osteoarthritis. And so there's several different things that that if your vitamin D levels are normal, or if you're low and you're taking vitamin D supplementation, there are several different things that you can actually help try to prevent down the road happening for you if your vitamin D levels are up. So first thing I recommend folks to do is to get plenty of sunlight so they can get their vitamin D levels up and drink plenty of milk. But if that's not feasible for you, and your vitamin D levels are low, then I do recommend some sort of vitamin D supplementation, and I recommend coming in and talking to me or your regular doctor and getting it checked and just see how low it is to know what the proper dosage of that vitamin D you need.
Younger people, you mentioned that, and I thought, younger people get out. They walk, they jog, they don't garden like we used to. We used to raise everything we ate. But you don't think that as you get older. You don't get out in the sun. You really don't. I remember one time, a long time ago, I had a tick on me. I said, I believe it came off a tape because I'm not outside that much, to the shop and back. We don't sit around. Long years ago, they didn't have air conditioning. They'd sit out on the shade tree or, they were in the yard a lot. Now we're comfortable.
Yeah,
That ain't good, is it?
that's not good.
Awful thought, awful thought. Okay, as we get older, now, the younger folks, I think it might be a fad now, but as we get older, really, a lot of times we're by ourselves, or maybe just us and the husband and or whatever, and we don't cook big meals, and you know, and we tend to go out to eat more. I don't know, we just tend to. You think, well, a lot of times if you figure it up, you can go buy a burger cheaper than you can cook. You got to buy a whole pack of ground beef to get any. Then you got to eat it till it's gone. You're sick of looking at it. Is it really that unhealthy to eat out?
I think it depends on what you're eating when you eat out, because a lot of these restaurants you go to, you really don't know what they put into the food, so to speak, as far as any kind of additive fats and various salts and things like that. So I do think that you can eat out some, but I think it's one of those situations where it's anything in moderation. And I do think it is healthier to eat at home. And one philosophy that I've heard is that maybe we should become more grazers rather than sit down and eat till we're full. And by grazing, what I mean by that is maybe we should, if we feel like we have low energy levels and we need to get a little pickup of energy to complete a task, eat just enough to get that energy level up, go complete your task, and eat more smaller meals during the day rather than eating the 3 large meals during the day.
That makes sense. That not overload your stomach. What about soda?
Soda.
Great American habit.
It's one of those things, again, it's in moderation. The issue with most of your sodas is that it's got a lot of simple sugars in it. Some of the sodas have cane sugar. I know Pepsi's got a cane sugar product out, and some sodas have what's called high fructose corn syrup in it. And both of them are simple sugars. Both of them, if you don't exercise and you drink it, they get stored as fat. The difference between the two is that for whatever reason, cane sugar, when it gets stored as fat, it seems to be evenly distributed across the entire body, whereas high fructose corn syrup tends to distribute itself more in the central area. And so that's the big major differences there. But like I said earlier, again, it's one of those things that's in moderation. I don't necessarily believe in diet drinks that much.
That was my next question.
Because the artificial sweeteners that are in diet drinks, the aspartame, the saccharin, some of the drinks that have the sucralose, which is the Splenda substitute, these are substances that your body really doesn't recognize what they are. And so you're coming into contact with, and your body just says, well, I don't know what this is. It just kind of pushes it off to the side. And I think a lot of people, they get so much pushed off to the side that it may contribute to a little bit of increased swelling and that kind of stuff. Plus, I've seen some studies on people that drink diet drinks, because these diet drinks have fewer calories than a regular Coke. They ultimately end up replacing those calories with some other part of their meal anyway. So I believe in the philosophy that if you want to drink a Coke, drink you a Coke. But it's probably not a good idea to drink a Coke at every meal, all day long, every day.
I make Kool-Aid with Splenda. That's bad, isn't it?
I wouldn't necessarily say it's bad, but like I said, it's Splenda is one of those substitutes, sugar substitutes that your body really doesn't recognize what it is.
Oh. Here I was getting to liking you. Look there. Look at there. Now, if you got to know, you got to know. Okay, on the same subject, how much water does a person really need?
I recommend at least 8 glasses of water a day. 8 glasses. Water basically does a lot of good things for you. Obviously, it has no added sugar or anything to it. It hydrates you. It makes sure that all your electrolytes are in balance. And it helps flush your kidneys out. And that's a good thing. It helps keep your urine from being so concentrated that it keeps you from having burning when you go to the bathroom and various things like that. It keeps your kidneys working properly.
If you drink too much water, can it make your feet swell?
I don't really buy into that idea, and the reason is that it's not the water that causes the swelling, it's the sodium that accompanies the water that causes the swelling. What happens when you get swelling is that sodium somehow leaks out of your vascular system and into the interstitial spaces, and where sodium goes, water follows it. And so that's what gives you the edema, is the sodium. So what I recommend is drink as much water as you want to, but avoid as much salt as you can.
Okay. How many hours do you want your patients to sleep?
I recommend, typically getting 7 to 8 hours a night. If you can get 8 hours a night, and that's back to the question about weight loss. If you're not getting good sleep at night, it's going to be hard to lose weight because your body needs that sleep to restore itself. It's called good restorative sleep, and I really try to tell my patients that they should get as close to 8 hours as they can possibly get to.
And now your clinic is it's next to the old health department,
It's
isn't it?
right behind the old health department. It's right there on the campus of the hospital.
Everybody knows where the old health department is. And the clinic is new, but he is not. He's from Ripley and went to school here. And your experience, too. I didn't realize you had so much experience. You've worked at Tupelo, you've worked at New Albany Hospital. I think that makes me a little more comfortable, too. Do you see a lot of people with arthritis?
Yes. Arthritis is definitely one of the main disorders that we encounter these days.
Now, if you've got arthritis and you don't want to be filled full of cortisone or Celebrex that the TV says is bad stuff, and is there anything safe that really helps arthritis?
Probably the best thing that's out there for arthritis is exercise. When you have arthritis, your joints are already going to be fairly stiff, and the more you stay sedentary, the stiffer they're going to get. So the key is to get up and get moving.
Here, I thought I liked you. Look at you.
The key is to get up and get moving so you can get the joint fluid flowing in your joints and help lubricate your joints. So arthritis is one of my mainstays in treating, exercise is one of my mainstays in treating arthritis. There is a study out there that shows that fish oil can delay the progression of osteoarthritis if you have it. And it can also, if you don't have osteoarthritis, there's some studies out there that show that fish oil may actually be able to help prevent you from getting it.
You're kidding.
And the key in that is that fish oil is very high in what we call omega-3 fatty acids. And omega-3 fatty acids are anti-inflammatory fatty acids. And omega-6 fatty acids are pro-inflammatory fatty acids. And I really feel like one of the things that we've probably done to ourselves that has contributed to so much osteoarthritis in these days is our dietary habits. We've got a severe imbalance of omega-6s to omega-3s, where we're taking in much more pro-inflammatory fatty acids than we are the anti-inflammatory fatty acids. And I think if we can reverse that trend, we may be able to prevent some significant bone disease that way.
And you would recommend fish oil?
Fish oil. I think fish oil is a pretty good supplement. You can take 2 to 3 grams a day.
I've tried fish oil. But now they make some now that you don't burp, don't they?
Apparently so, yes.
That one I took, it was rough stuff. That was some serious. You knowed you're sick and you swallowed that thing. All this exercise on that bone that's already sore and stiff, that sounds awful. It'll get worse before it gets better, won't it?
You may feel like it's getting worse, but ultimately in the long run, the fact that you're keeping your joints moving is going to keep them from getting stiffer, and getting stiffer in the long run is what's going to cause the arthritis to get worse.
Now, a lot of the older folks, younger folks, some of them have, but not like we do. You can check out this gray hair. I know about arthritis. If you get one of these exercise bikes that does the arms, that's about every joint, isn't it?
Just about it.
I was thinking, some of our older folks don't drive. or don't drive over in the evenings, or maybe are on limited income and cannot afford this wellness center. And if you just get one of those bicycles, that would help, wouldn't it?
If you get a bicycle, if you can't afford a bicycle,
And make
I
yourself
recommend-
get on it.
If you can't afford a bicycle, just walk. Get out on your local street, figure out how much is a mile, and just walk it. Walk it for 30 minutes a day, 5 days a week if you have to initially. You know, you may want to gradually work into it, but the idea behind it is to try to get to the point that you can actually get your heart rate elevated. And so you might have to, instead of a normal walk, you might have to do what's called a speed walk to get your heart elevated, the heart rate going, and that way you're burning calories.
Now, my friend has had open heart surgery long years ago, and she has friends that live close, and they just make a group and walk, you know, at 5 o'clock in the morning. While I'm sleeping, they're walking. That's it. But, you know, that really is, I hadn't thought about that, but that is good. You know, it doesn't cost anything.
Yeah.
When we get older and we get on fixed income, you have to think about, you know, that's one of the problems we have. Like we were talking earlier, it's hard to get older people to go to the doctor. They're just not going to go, and I'm pretty stubborn myself. Not bad as Tate, I don't know. But men are worse. I figured that out. If they're not, us ladies will agree, won't we? Yeah. We vote men are worse. And a lot of it is that we can't afford the bills. You know, you get older, you're on a fixed income. You don't want to go run up an office visit you can't pay for.
That's right.
You know, and I think it's pretty close to $100 now to see a doctor. You know, and who's got it?
Yeah.
And if you don't have insurance to cover it, there you are. You know, sometimes, maybe we're hard-headed too, but sometimes we just don't have money. Just do not have the money. Is there any help out there for these people that don't have insurance and don't have the money?
That's something that I have to actually research into to see how much help there is out there. There are various hospitals in the area that have charity programs that you can apply for and perhaps get. I know that the residency program that I trained at has a charity program that a lot of patients that didn't have the means to pay for their health care could get on the charity program, and the charity program would pay for their health care and their medications and whatnot. But that's, you know,
that's a thought. You know, a lot of times people don't go because that they don't have the money. In fact, I know of one man that long years ago, he started bleeding, and he, of course, had hemorrhoids is what he had, but he just worked in the field, and he didn't have any money, and he died. You know, people die for lack of, you wouldn't think that in America. No, you just wouldn't think it. But he never went to the doctor. He just died. You know, and it wasn't that he was stubborn. He didn't have no money, you know. And now, as we get older, we realize that these folks that are older, you know, that you always thought, well, they on a fixed income. Well, yeah, it ain't too fixed. You know, it might be too fixed, you know. But they just don't have the funds. They just don't have it, and we need some kind of a program where they could maybe pay a little each month, or you know, till they got it paid out, or something. It's something to think about. We just got through Christmas, and it's all on our mind. We've all eaten stuff we didn't need. What about all this fruit that goes through at Christmas? Is fruit really all that good for you?
Well, I think that's one of those another thing that's dependent upon where you get it from. You know, I really believe in fresh fruit and fresh vegetables. You know, if at all possible, I would prefer to eat it directly, pull it out of the ground, clean it off, and eat it before it's ever processed or anything like that. But I do feel that fruit is good for you in the long run because it's got a lot of vitamins and minerals in it that are beneficial to you, particularly vitamin C.
Oh, we're halfway through. Tony, you'll cut us to a commercial, and we'll let you get your breath.
All right.
Fast, hot, and fresh. Open 24 hours just for you. Dodge's store. Come be our guest. Dodge's Store, Ripley. We are 100% employee owned with friendly service and a fun atmosphere. High quality, low prices. We are Food Giant. Our deli serving breakfast, lunch, supper. Food Giant, 702 Highway 15 North, Ripley. Come shop Food Giant. Want fresh meat and fresh produce? Food Giant's the place. High quality, low prices, Food Giant. This program brought to you by Cardinal Drive-In. Cardinal Drive-In, 1807 City Avenue North, Ripley. Cardinal Drive-In, 837-2970.
And I'm glad you stayed with us. We're in the studio with Dr. Keith Box. He's opened the new clinic behind the hospital next to the old health department building. And the building is new, but he is not. He's a Ripley boy, went to Ripley schools, he's worked in Tupelo, he's worked at the New Albany Hospital. He is experienced. And we're glad to have a new doctor here. Well, not new, but we're glad to have a new to us doctor here. Mm-hmm. We're just so glad that you decided to open this clinic here in Ripley. Mm-hmm. While the commercial was on, I remembered that I told one of my friends that I was interviewing you. I was bragging about it. And she said to ask you about this long-term use of prednisone. Mm-hmm. She has problems like hair loss and sight changes. What does prednisone do to us over a long period of time?
Prednisone is one of those medications that it's just like any other medication. It's not a benign medication, that there are side effects from it. One of the side effects from long-term prednisone use, if you have an inflammatory condition already in place, mm-hmm. which is typically why you're on prednisone for long-term use, is that you can develop a disorder called avascular necrosis. And what that means is it's a lack of blood flow to a particular bone or an area of the bone. The most common area is the head of the femur, which is basically the ball that goes into the socket of the hip. And what happens is you get a lack of blood flow there, arthritis sets in, and basically that head of the femur dies off. And it becomes probably some of the worst osteoarthritis you've ever had. So that's one of the long-term potential complications of long-term prednisone use. The other thing is that if you're on long-term prednisone use, and even if I know a lot of people when they have upper respiratory tract infections, they like to come into the clinic and get a steroid shot. Well, the side effect, the big drawback to getting a bunch of steroid shots like that is that after so many of them, your adrenal gland actually makes that hormone itself. And so you get so much of this prednisone and steroid in you that basically it tells your adrenal gland, you know what, we've got enough, stop making it. And so then when it wears out, when that prednisone and that steroid gets out of your system, basically you can go into what's called an adrenal crisis, where your adrenal gland's not making enough cortisol. And that's a disorder called Addison's disease. And it can be a fairly dangerous thing to happen. So, and when patients come in and they need a steroid shot, I let them know before I ever give them the risk and benefits of getting these steroid shots, and that's the potential, that there is potential for having those two. Those are the two most common things that are caused by steroids.
Now, it's not just shots. A lot of times they prescribe pills that you take every day.
And it's the same thing with the pills.
Ooh. And it'll cause your body to quit making prednisone.
It can. A long-term use of it, it can definitely, there can be some cause there. That's why if you're on long-term prednisone, doctors typically try to put you on the lowest dose that they can. They'll actually treat your condition to try to decrease the chances of developing those long-term problems.
Well, when you've got a long-term disease, something that's not going to go away, I mean, such as COPD or, something that doesn't get better, toward the end stage of it, a lot of times they'll give you a lot of prednisone, don't they? Is that
Typically,
a bad thing?
if you're not necessarily in that, most of the times if you get put on a high dose of prednisone or another steroid, whether it's Solu-Medrol or hydrocortisone or any of those, if they put you on a large dose of it, it typically over a period of time it'll get tapered down. And that taper helps keep your adrenal gland working, because if you get a high dose of it and it shocks your adrenal gland and your adrenal gland's not making it and you suddenly stop it, then you could go into that adrenal crisis that way.
Ooh, sounds dangerous to me. It really does. It's scary to me. It sounds bad. And, you know, I've taken prednisone before. I had pneumonia, and they gave me prednisone.
Yeah.
I mean, all I can tell is it made me eat myself to death.
Yeah, you know, there are definite medicinal uses for prednisone, particularly in patients that have lung disease that gets flared up. Just about the only way that you're going to get that to cool off is with prednisone. And even with some of your osteoarthritises, back pain, whatnot, probably the best medication that's out there for it is a steroid medication. So,
Well, now this, on this lung disease you've touched on, we got a couple of guys involved here that have that. And is it that you jump on prednisone and get off, or?
it's more of a short course of it. You have an exacerbation of the lung disease, you take steroids for a few days, hopefully we cut that lung disease out, because in chronic obstructive pulmonary disease and emphysema, the key to it is the inflammation that's in the alveoli and the bronchial tubes in the lungs. And the best way to knock that inflammation out is with steroids.
Well, this, one of our guys has got the lung disease, and then his heart doesn't put out enough. And if he doesn't take the prednisone, he's just zapped out. Just, I mean, no quality life. Is there any alternative to prednisone?
Right off the top of my head, I cannot think of one right now in certain disorders. Of course,
Sometimes there's nothing else.
Yeah, sometimes there's nothing else. And relative to him, I hesitate to say without knowing exactly what's going on whether there is an alternative to prednisone or not.
But sometimes you just got to do what you got to do. And that's kind of, I think that's the situation. I was wondering, this prednisone, does it make your hair come out, or I mean, are you looking at physical side effects? I mean,
the most common physical side effects of steroid use is that the most common things I see is that sometimes it'll wire you out at nighttime because that initial burst gets in you, and it makes you not want to sleep that first couple of nights. Typically that wears off after a while. Some people get a flushed feeling from steroid use where their face may turn red, they feel like they're getting hot and sweaty. That's a fairly common side effect. And the other side effect that some people get, and it's probably not a very desirable side effect, is probably the side effect that most people are more concerned about because of their mindset, is the fact that steroids stimulate your appetite. And you may gain a little bit of weight while you're taking the steroid. And, you know, I guess vanity takes control of all of us there, and we don't want to gain weight. So
well, gain weight's not healthy either. You know, sometimes everything's got a side effect, doesn't it?
Every medication that's out there has got a side effect. There are no benign medications.
But if your face flushed and you feel faint feeling, and we can't feel good
you wouldn't necessarily
anyway.
feel faint, but you'd feel hot, and you'd be like fanning yourself and uncomfortable. And, you know, dead of winter time, if you've taken a steroid shot or taken some steroids, you might be feeling like you want to crank the heater down. So
that's something to think about. Something to think about. Well, is there any help for psoriasis?
there are various medications out there for psoriasis. There are topical treatments. One of them is steroid creams, which are not as bad as tablets or injections because you don't really absorb these systemically They're just topical treatments. Typically, if it's a mild flare-up of psoriasis, steroid cream will typically work. There's also creams out there that are immunomodulators, and you've probably seen Phil Mickelson's commercial on television where he's got psoriasis, but he's also got arthritis from the psoriasis called psoriatic arthritis, and he takes a medication called Enbrel, and this medication is an immunomodulator that helps out with psoriasis. But those are probably the two best things that are out there for psoriasis. And if the psoriasis is bad enough, one of the things that we do as primary care physicians, family medicine doctors, is that we can treat pretty much anything up to a certain point, but there's certain things that we know when we should get you to a specialist for. And psoriasis is one of those things that if steroid creams and Enbrel doesn't really work, then it's probably time for you to see a dermatologist for that and see if there's anything that they can offer.
Okay, if we're running pretty close up, can you tell us how to know, as we're getting older, we have to face this, how can you tell the difference between ulcer pain and chest pain?
You really can't. You really can't. If you're older and you're having chest pain, my recommendation for you is to go to the emergency room, because if it is cardiac pain, and in some people it's not cardiac pain, but if you have chest pain and you notice that you're having chest pain on exertion and the pain's going down to your arm or up into your neck, and you get short of breath and sick at your stomach with it, you should go to the emergency room and get that checked out, because if it is your heart and you're having a heart attack, if it's not treated, you could die.
Well, elderly folks, I'm getting elderly, that's why it's on my mind. We have a lot of health issues, and one of them, you worry about getting impacted. I never heard of it before, never crossed my mind, but it's dangerous, ain't it?
It can be.
It's bad stuff. We had a little episode of it in the family, and I called a friend, and he said, "You're at the hospital." He's constipated and at the hospital, but it ain't like that, is it?
No. What happens in an impaction is that you go for so long without having a bowel movement that the stool gets basically lodged in there and it's just not moving. And nothing else can move through. You're typically not passing any gas. Your stomach may be distended some. You have abdominal pain with it. And particularly in elderly folks, my training in nursing home care in the past, I've seen elderly folks that, due to constipation, have basically gone into what we call altered mental status. They get confused, disoriented, and chances are, if you don't get that taken care of over a period of time, there's could be some potentially serious consequences for that.
Could get real serious.
I think the key to the prevention of that is, making sure that if you're eating a regular diet on a daily basis, I recommend a high fiber diet. I think 30 to 35 grams of fiber a day, whether you're elderly or you're young. There's benefits to eating that much fiber in a day. It keeps you regular. It helps prevent colon cancer. And if you notice, I focus a lot on preventative stuff. That's one of the things I key on is
I don't want to get
preventative medication.
sick. Don't want to get sick.
I would just assume people not get sick and prevent all these diseases and disorders down the road than to wait till they get sick to start trying to deal with it.
Okay, I want to get one more question in.
Okay.
As we get older, we get these ugly brown spots on us. Everybody watching knows I got one right here. Big old brown, ugly looking. Is that something I need to see a doctor about?
Anytime you got an unusual lesion on your body that you're unsure of, it's probably a good idea to get a doctor to see about it. Now, some of these spots that come up, and particularly in elderly patients, if they have a stuck-on appearance, they're typically called seborrheic keratosis, and they're benign. But I do recommend that if you have something that you're not sure of that's popped up on your body, go to your doctor and get him to look at it and look at any various other skin. In fact, I recommend getting at least a yearly skin survey just to take because I know we talked about earlier that we don't get out in the sun enough. Well, one of the side effects of getting out in the sun too much is that it can cause skin cancer. So you're
Well,
kind of in
that's
a
right.
catch-22. And so
That's
I
right.
really recommend people coming in on a yearly basis, if not a 6-month basis. A yearly basis, if you don't have a history of anything, probably if you've had skin cancer before, you probably need to get looked at every 6 months. But I do recommend that to kind of help for the prevention of developing some type of melanoma or really deadly skin cancer.
Okay. Now, we're running out of time, and I want you to walk me through an appointment.
Okay.
We just got 4 minutes, but I want you to walk me through an appointment. I call and I get an appointment. I arrive, I sit down in the waiting room, and then?
Well, first thing you're going to do is when you come in, you're going to sign in. My staff, my receptionist, she takes that sign in. She puts your information in the computer. If you haven't been to see me already, if it's the first time that you've come in, there is some paperwork that you have to fill out. That's mostly for insurance information. Once you fill out that paperwork, you give it back to the receptionist. She puts it into the computer. She gets a super bill ready for you, sits it in the slot. My nurse comes around and gets the super bill, and she'll bring you back. Once my nurse brings you back, she will talk to you some. She'll get your vital signs, check your weight, check your heart rate, and she will take you to the examination room, and she will ask you various questions. What's your past medical history? What's your past surgical history? What medications do you take? Do you smoke? Do you drink? Then once she gets all that done and she puts it into the computer, then you're ready for me. Once everything's done, I come into the room, I talk to you, I do my examination. We try to figure out what's going on. If I need to get lab work, I put an order in for it. My nurse comes in and draws the lab work. Some things we can check in the clinic, some things we have to send over to the hospital to check. But typically, when things get going good, my goal is for a new patient. My goal is I hope to have you in and out of the examination room within a 30-minute time period.
That's a plus.
And if you're an established patient and I know your medical problems and you're just coming in for a follow-up, I'm looking at a 15-minute time period.
Oh, that is a plus. You know, Tipp County is well known for these all-day waits. You know, that's what I hear in the beauty shop. People say, man, I can go to Memphis and back and see a doctor. You know, we are really known for that. I think it's caused sometimes, because one time I called a doctor and got an appointment, and she said, you can be his 4th 9 o'clock. How you going to see 4 patients at 9 o'clock?
Yep.
But I mean, you know, I think that is something extra. I really do, that we can do that. Now tell us one more time where you are.
All right, we're on Hospital Street. It's 118 Hospital Street. It's over on the campus of the hospital, right behind the old health department. And our hours are, we open on Monday through Friday. We open at 7 o'clock in the morning. We do that for people who work night shift that may get off at 7 o'clock. They can come in at that time period, get seen, and get home so they can go to sleep. And people who have to go in at 8 o'clock in the morning and they work all day long and they can't get off to come in to see the doctor, they can come in during that that morning hour and get seen before they go to work. So we open up at 7 o'clock in the morning. Monday through Thursdays, we're open till 5 in the evening. And on Fridays, we're open till 12.
12.
And we take, from 12 to 1, we do take an hour for lunch. Of course, you know, if it's an emergency situation, number one, I recommend you go into the emergency room. But if it's someone that needs to be seen immediately and they come in, you know, I will stay late and see them, or I will see them through lunch.
Okay, give us the phone number.
Phone number is 993-9255.
I tell you, this guy sounds good to me. I think we need to check out this doctor. It's new to us. He's not new to Tipp County, but he's new to us. And Dr. Fox, I appreciate so much you coming.
Well, I'm glad y'all had me.
We've enjoyed this hour together. Don't forget the Jeter Family Program, Saturday night at 7. I do hope you'll tune us again next Monday at 7 o'clock for Daryl's Little Corner. May God